Welcome back to Nursing with Bonomi. I'm Nurse Nay. Today we're going to talk all about progress notes. Okay, so this is what you can do if you have a new medication ordered. Patient has complaint of nausea today. No emesis present. Patient does not have signs of constipation. Bowel sounds present in all quadrants. Abdomen soft, non-distended, and no pain present upon palpation. Doctor so-and-so notified. New order received for ondansetron 4 milligrams every 6 hours, PRN, for 2 days. Patient and family notified of new order. Since you started a new order, you should also put in a follow-up note. Also, because it was an as-needed medication, you should always put in a follow-up to say, hey, it worked. So that could say, it's very simple. You could say, PRN administration of ondansetron effective. No complaint of nausea and vomiting noted. Done. All right, what if your patient gets an antibiotic order? You can say, patient has burning, complaint, frequency, increased confusion. MD notified. New order to obtain UA and begin PO Bactrim DS 160/800 milligrams BID for 14 days. Patient and family notified. Throughout the duration of the antibiotic, at least daily or per shift, somebody should be documenting on how it's working for the person. So you can say, patient continues on Bactrim DS for treatment of UTI. No adverse effects noted. Patient denies dysuria. Confusion has decreased and patient is returning to baseline cognition. So that's important to put in there. Stay tuned because I came up with something amazing. It's an acronym for what to do for progress notes. So stay tuned, that's coming. What if you gave somebody medication for anxiety? You would write, patient noted to be yelling out and combative with staff during care. One-to-one, food, repositioning, not effective. That's it. So ordinarily, when you administer a medication in the MAR, you have the option of adding a progress note. That is where I would put that type of progress note. If you don't have that feature, at the end, I would add PRN alprazolam given per order. Now, you also need to do a follow-up note. This would say, PRN administration of alprazolam effective, patient resting quietly in common area watching TV. Done! The more you get used to it, it's just going to be so easy, you guys, and these words are just going to flow, and it'll be great. You guys are going to get really good, so start having confidence. Don't be so hard on yourself. It's going to be fine. Okay, let's say you need to give a pain medication. You can write, patient has complaint of aching pain to right shoulder related to recent surgery. He states it is a 5 out of 10. Not relieved by ice pack or change in position. PRN Percocet given per order. Okay, follow-up note. PRN pain medication was effective. Patient states pain is now a 3 out of 10, which is patient's stated pain goal. Now, what if somebody refuses their meds? This is what you can put. Patient refused meds times 3 attempts despite education. MD notified. So, some people are alert and oriented and refuse to take their medications. At that point, for instance, somebody has a blood pressure of 180/95 or something, and they're like, I'm not taking that blood pressure pill. This does happen, by the way. You say, okay, well, your blood pressure is pretty high and you could have a stroke. I don't care, I'm not taking it. Do you understand that you might have a stroke if your blood pressure doesn't decrease? I'm not taking it. And then just, okay. That's it. And then just leave. Because sometimes they get really nasty and mean. But you do need to try at least a couple times. And you have to educate the patient so they know what they are refusing. Sometimes you have the elderly patients with confusion. They're just not taking it because they're confused and they just don't know what they're saying. Also, sometimes you can convince a patient to take like their most important medications that they have. For instance, like a Coumadin or blood pressure pill. Sometimes you can say, what if we just take this one or that one instead of taking a whole cup of pills? That works. Don't forget, I am going to be telling you an acronym that I came up with. So don't leave yet. Alright, what if somebody is admitted? This is what you can say. Patient was admitted to room 105 via stretcher accompanied by one EMT on this date at 1300 from University Hospital with diagnosis of generalized weakness. Patient oriented to room, medications discussed, denies pain or discomfort at this time. Meds verified with Dr. S at 13:15. Vital signs stable at this time. It's important that you put in an admission note as soon as possible because something bad might happen to that patient and then you didn't even have the admission complete. That happened to me once. The day shift nurse stayed over late to finish her admission. Thank God she did, because the same night that guy had to be sent back to the hospital and I wouldn't have known anything. Like, it was just extremely important and good that she had done that admission, so we had information to go off of and information for the hospital as well. You never know what's going to happen, so it's good to chart as you go if possible, because you never know. Okay, if somebody is discharged, patient discharged home on this date at 13:05 via transport. Vital signs stable upon discharge. Medication and discharge education reviewed with the patient. Patient verbalizes understanding. Scripts and 3-day supply of medications sent with the patient. Alright, so that's a lot of example progress notes. Now I want to tell you my acronym that I came up with. It is PAIN-ED. It stands for Problem, Assessment, Intervention, New Order, Effect, and Discuss. So, PAIN-ED. So, P is for problem. You're going to document your problem, the patient's problem. A is for assessment. You're going to document the assessment that you performed. I is for intervention. You document your intervention. N is for new order, for anything that you got from the doctor. E is for effect, so you're re-evaluating the intervention and new order that was provided. And lastly, D means discuss. So you're going to discuss it with the patient and the family, let them know what's going on. So PAIN-ED. This is going to give you the formula that you need to fill out your own progress note. Let's take one progress note and break it down to see how the letters of our acronym apply. So we're going to go back to the new medication order. Patient has problem, nausea today. A, assessment. No MS is present. Patient does not have signs of constipation. Bowel sounds present in all quadrants. Abdomen soft, non-distended, and no pain present upon palpation. Intervention. Soda provided per request, lemon lime soda. Instructed to lay on left side. Okay, that was not effective. New order, N for new order. New order received for ondansetron 4 milligrams Q6 hours PRN for 2 days. E, that is going to be your follow-up note saying administration of PRN Zofran effective, patient denies nausea and vomiting at this time. Period. Okay, D, discuss. Patient and or family notified of new order. PAIN-ED. So, there you go. Okay, this is going to work for most of your progress notes. For most of your initial progress notes. I would say that the follow-up notes are going to be a little bit different because you don't have to have so much information in it. So, if you stayed this far, please put an emoji down in the comments because I want to know who you guys are, and let me know if this was helpful. Don't forget to download your free fall progress note template because it's amazing. And I have other things in the works for you guys too. So please don't forget to subscribe and like us. Make sure you share this with anybody that this is gonna benefit, because that's why we're here. We want to help you guys, help our new nurses learn how to become nurses on the floor by putting the page into practice. Thank you all so much. Have a fabulous day.